start by telling me what you've studied when it comes to air quality and wildfires, and then how it impacts human health?
Right. So when there's wildfires and you see the smoke, what you're seeing are what we call PM 2.5, which are solid and liquid particles that are 2.5 microns or smaller in diameter. And that's the air pollutant we've studied most from wildfires. But wildfires actually emit lots of different air pollutants, but that's sort of what you see. The other air pollutants are gases. And those particles, though, that you see have been studied for decades in terms of their health impact, but actually the wildfire PM 2.5 has only been focused on, it's not been as focused on as the PM 2.5 from other sources, but we know that the smaller the particle it is, the deeper it gets into the lungs, and it can not only affect the respiratory system, but it can also affect lots of other systems in the body. So some of the simplest and most evidence impacts on health are that most people will feel maybe itchy, watery eyes, a cough, a sore throat when the air pollution is bad from wildfires. And that's very common. But then individuals who have chronic lung disease like asthma or emphysema, they often feel more symptoms, especially if the air pollution is higher and longer duration. And they're more likely to need to use their medication more. They're more likely to show up at hospitals or emergency rooms with complications associated with respiratory health. But we've also seen, and there's evidence to show that these particles can get into the bloodstream in the lungs, and they can be found throughout the body. And so more and more evidence is showing impacts on many other systems. So we've seen some evidence that wildfire smoke can affect cardiovascular disease. So there's more there's some evidence of more heart attacks or people showing up at the hospital with complications of cardiovascular disease. And then additionally, there's growing literature showing impacts on developing fetuses and on the health of pregnant women. So they can, there's some studies that show impacts on rates of preeclampsia, which is high blood pressure during pregnancy. And then additionally, there hasn't been as much research on this, but there's also evidence, some evidence of impacts on metabolic health, so like diabetes or kidney health, or there's also people looking into how particles sort of affect the brain. So there's more and more research showing more and more impacts, but a lot of it is very preliminary at this point. The respiratory health is very clear. There's also studies that show in places that experience wildfire smoke every summer, you can see sort of impacts on all-cause mortality, that there's sort of these, when you have spikes in air pollution from wildfire events, you can have spikes in mortality as well.
Interesting. So going back to the particle size, you said the smaller the particle, the deeper into the lungs. What causes a smaller particle size versus a larger?
I'm not an expert on the combustion process. There'd be other people who would really study that more, but I do know that with wildfires, so I said PM 2.5, it's all particles 2.5 microns or smaller, but we know with wildfires that the actual combustion process often creates most of the particles that are created in that process are about PM1. So they're about 1 micron in diameter. And sort of our ability to detect these smaller particles has been improving, and therefore we can study smaller particles and really understand the health impacts of those smaller particles. But the smaller ones are the ones that can get into the alveoli, causing sort of inflammation in the lung, which can spread over to inflammation that affects other systems. But it also, those can get translocated into the blood, and then they have been found throughout the body.
So I'm curious what you know about kind of the distance traveled when it comes to wildfire smoke too, and how far the reach is for the impact, especially relevant to right now with the wildfires in Canada and impacts being felt in the United States. How far can this reach?
Right. Well, so with the health impacts, we do know that the higher the concentration of these particles, the worse the health impacts are. But we also know that there's no threshold at which it's safe, like that you can find impacts on health at low concentrations such that you wouldn't even see the particles, yet you're breathing them in and you could be affected. And And as they travel, they do sort of disperse, right? If you can sort of look, there's a bunch of websites that'll show the plume from these wildfires in Canada, and you can see how they're moving due to wind and weather patterns, which is again something you should ask someone else. But when you watch those, we do have evidence that the air pollution from wildfires can affect places much farther away. Currently, on the East Coast, they're having really bad air pollution from the Nova Scotia fires. I'm in Colorado, and we had a very bad air pollution event because of the particles from the Alberta fires. So these particles can spread really far distances, and there has been evidence of health impacts from this long-range transport of smoke.
What about children? Or do you notice any sort of impacts with children? They're running around outside all the time, even more so than adults.
We're often very concerned about children's health from air pollution because not only do they probably spend more time outside, but they breathe more per unit body mass than adults do. It's just about the physiology of children. And so it's the idea that they're probably getting a higher dose of the air pollution per unit body mass. However, in the epidemiological studies that I've done and I've reviewed from others that look at differences by age, some show, and we also think of the elderly as being more affected too. And that's often because of underlying health conditions, that they're just more susceptible. Their immune systems are not as robust. And we know that these particles can affect immune health such that, upon exposure, they're more affected. However, in a study that I did, we found that working age adults were more likely to go to the emergency rooms for asthma than children or the elderly. And that could actually be about a behavior effect. In that, parents might be making sure their children are staying indoors when there's wildfire smoke versus they're not doing this, they're not protecting themselves in the same way that they're protecting the people they think are more vulnerable. It's also that some amount of those adults might be working in outdoor jobs and therefore getting a very high dose, and possibly it's those individuals, but we need more research to understand that. At the same time, other people have done research into which age groups are more affected, and I would say that across the studies that have looked at this, there's no consistency. And so we really need to understand this behavior aspect because people do change their behavior when there's wildfire smoke. Often it's, in the news, the air pollution is so bad you can see it. So you might be more likely to take precautionary measures that you might not when it's sort of an average day of air pollution.
Are children less likely to have underlying disease too?
They are. So that's possibility too. There's also, so children, the one disease that children have that is often exacerbated by wildfire smoke is asthma. Studies that look at lung function, and some of them have looked at people both with and without asthma and how the wildfire smoke affects lung function. And interestingly, they find more of an effect among people who don't have asthma. And the hypothesis is, but it needs to be investigated further, is that people with asthma, they're taking their medication, which improves their lung function. And the people who don't have asthma don't have that medication. So therefore, they might be more affected versus there's sort of this, it's again, a behavior that sort of is protective and helpful for those who have inhalers or other medication for their lung function.
It sounds like in the next decade or so, we're going to find out a lot more about this topic, right? It sounds like you guys are doing a lot of work.
When I started researching health impacts of wildfire smoke, there were a few different research groups, and most of the work was coming out of those research groups. And now there's more and more people who are diving into this. And I think it's because wildfires are becoming much more intense. And also there's studies that show that particularly in Western North America, a larger chunk of the PM 2.5 that we're exposed to is from wildfires, because we've been doing a really good job of regulating PM 2.5 from tailpipe emissions from factories and refineries and things like that. But so wildfire smoke is sort of a larger amount of what we're breathing in when we're breathing in PM 2.5.
And wildfires are just one piece of the puzzle, right, when it comes to climate change impacts. Have you been studying any other climate change impacts on human health?
I have done some work on some other areas, but wildfires has really become a big focus for me. I was doing a variety when I got into wildfires, and then I just kind of got really fascinated by it, and I've really focused in there. But I'm really interested in actually these exposures that happen together. So I really want to look into heat and wildfires. So where I live in Colorado, when you have wildfires, it's often really hot, and that actually complicates what we tell people to do, right? We tell people to close their windows and doors. And if you don't have air conditioning and it's hot, you aren't going to want, you could actually get more harmed by keeping your windows closed, possibly, because it gets so hot. So there's these sort of compounding impacts of climate change that I really feel like we need to look into and figure out solutions for people so that they can protect themselves from both of these exposures at the same time.
A lot to worry about.
Well, I mean, I should also say, like, there are things that people, so like you can put a filter, like a MERV 13 filter on your box fan that you put in your window, so that when it brings in the air to cool, it's getting filtered, so the particles are getting caught by that. So there's good evidence on that. And it's a lower cost solution than like getting an air conditioner and paying for the increased electricity costs.
Oh, cool. Where can you just buy that at like Lowe's?
Yeah, you can go to your local hardware store, and you can get one of these filters, and you fit it onto a box fan that you can put in your window, and you can just use duct tape there's all sorts of things on the internet on how to do this, that people should always check out. That if they have a newer box fan, then it's less likely, like some of the older ones didn't have some sort of protector on it that could cause like a spark that could cause a house fire or something. So like, anyway, there are these things. Get a new box fan, get a new filter, and put those in.
If you like this content, you'll love our podcast. Check out Off the Radar. You can find it anywhere you listen to podcasts, or click the link in the description of this video.